I am Dr. N.K. Venkataramana, neurosurgeon, Brains Super Speciality Hospital. Among the headaches, one more interesting type of headache is called cluster headache. So, this comes in people in middle age, both in men as well as in women, majority are in men. The headache comes at a particular point, either in the front or sometimes in the back. It comes at a particular time, that is very interesting. Once it triggers, you can check your time, it starts at that particular time, it goes on for a while, for few days or to few weeks, and then gives a long gap, and for months it may not come back, and then again it can start at the same time. So, when it comes by like clock. So, this is why it is called cluster. Cluster means it comes in groups for a few days and then gives a break. And normally we investigate these people for underlying blood vessel abnormalities. If these blood vessel abnormality is not there, then they can be treated. And whenever this headache starts, we should start treatment immediately. And once the treatment is started immediately and then taken for a period of time, it can stop the headaches both in severity and intensity, and they can have a prolonged headache free interval. We call it as a relapse. Okay. So, there are certain lifestyle modifications. One can have an individual risk factors like a trigger factors. Some may be allergic to some food or something might be triggering. You must carefully identify them, make a note and then avoid them. The best way to do that is to maintain a diary. We call it as a headache diary. So, whenever headache comes in the previous 1 week, what all the events that have happened, you keep noting it out, and then if you have a common factor identified, it is better to avoid that, so that you can prevent the headache itself.